Health Minister Dr. Zweli Mkhize is back in the Eastern Cape to monitor the response to the COVID-19 pandemic. Let's get more on the story with our reporter Atule Joka in Mthatha. A very good afternoon to you, Atule. The Health Minister is speaking about how there needs to be many changes in terms of how people do things, but also not neglecting the current diseases that people are dealing with just to focus on COVID-19.
Well, greetings, Zinga. We are coming to you from Nelson Mandela Academic Hospital. The minister is expected to make his way here in any minute now. As we know that Mthatha has been bombarded with quite a number of issues from healthcare workers who've been contracting this novel coronavirus to a number of healthcare facilities which have been temporarily closed down here in Mthatha. So he is here to try and address that. Just about a week ago, we were here as well. The Portfolio Committee on Health, led by Dr. Mkhize was also here. They tried to deliberate over some of the issues that are engulfing this part of the Eastern Cape. They did mention that they were not quite happy with the number of the readiness of the quarantine facilities here in the Eastern Cape, and also the provision of PPEs, which are protective personal equipment, which has been quite a problem in a number of facilities here in the Eastern Cape. We've been crisscrossing this province, going to those health facilities to try and meet with some of the nurses who wanted to be hidden in fear of victimization, saying of course that they do still experience this problem of a lack of PPEs in some of those health facilities. But I was watching a package by my colleague Funani earlier on saying that about over 1 million PPEs have been provided here in the Eastern Cape. So hopefully they will reach those hands that are intended to, because very often we did hear that some of the PPEs were in some storages, were provided to some health facilities, but the authorities would not give them to some of those health officials. So the issue of health officials still contracting this coronavirus, especially those who are in the front line, is still on the uprise in the Eastern Cape, and also OR Tambo is also now a hotspot as well. So also a number of issues. Another question we do want to pose to the minister is that we did hear the president saying some of the regions which still see a spike in the number of cases will move to level 5. So we'll hear if this will happen here, because in Mthatha it has been a business as usual. So it is quite even much more now that other sectors are open as well. So we will wait for him to see how he is intending to address those problems of the quarantine facilities and also the provision of PPEs here in this region. Also some of those healthcare facilities which were quite a problem. And also, Zinga, another interesting point which we covered last week, it was a case of a private hospital, St. Mary's, where the workers approached us to say that they were thinking that their hospital was not declaring the real statistics of the case of numbers there. And also Dr. with the Portfolio Committee on Health, they did go there to try and intervene. So those are quite a number of issues that are engulfing this part of the Eastern Cape, and we will be hearing what the minister will try and address those problems. And Zinga.
Atule Joka reporting to us from Mthatha in the Eastern Cape. He will be looking for those answers as he's just described.